An oculofacial plastic surgery is actually a subspecialty within ophthalmology that focuses on the application of plastic surgery techniques for the reconstructive and rejuvenative efforts in the periocular area. Or to break it down more simply, if you played peekaboo, the area that covers your eyes or your hands cover is the area that I deal with.
I totally understand now. Thank you
Yeah.
for that visual aid. It seems really specialized. A lot of training.
There is. So on top of my 3-year ophthalmology residency, I actually did 2 years of fellowship dedicated specifically to kind of learning and refining those techniques that I use on a day-to-day basis.
So we're talking about that peekaboo area.
Yeah.
So what typically are you doing for patients? What do they need done?
It all depends, and really every patient in this area is truly unique. So the first step is consultation, where we can get a chance to kind of sit down, talk about your concerns, talk about your goals, and kind of form that partnership that allows us to go through this journey together. And then from there, based on my assessment, we figure out kind of what the right fit is for you.
I think when dealing with your face, especially around your eyes too, surgery can make somebody a little nervous. So is it always surgical? Are there less invasive options also?
So that's a good question. So there's a range of services that I provide, ranging from minimally invasive, such as some of the neurotoxins or hyaluronic acid fillers that we already talked about, and that goes up to surgical interventions such as brow lifts or upper and lower blepharoplasty. But oftentimes there's a combination of these things. They kind of work synergistically together. And as I said, every patient has different goals and different anatomy, and oftentimes there's a range of options that we can provide depending on what that goal is.
Would that also mean that there's a range of like recovery time for all the different procedures, or how many procedures you get done? What's a typical patient?
There are. So for our less invasive procedures such as Botox and fillers, you walk out that day, typically patients can expect minimal bruising, but you're right back at it. Other more surgical procedures, there can be a little longer recovery, but really it's faster than most people think.
Do you think for a lot of your patients it's really surprising they didn't realize maybe something's bothering them, but they didn't necessarily realize how you could fix it? I suppose.
There is. A lot of people come in with kind of a predetermined notion of what they heard on TV or what a friend had, and really oftentimes they're surprised about what different options we have and the impact of those different options.
That's really neat. And that's why it's so great to see professionals at Esteem for something.
Absolutely. We have a
like
great
this.
team over there.